Hi, my name is Brittany. I'm a second-year FNP student at Radford University, Carilion. I would like to do a head-to-toe exam on you and record it for others to see. Can I have your consent?
Yes.
Okay, I'm going to go ahead and wash my hands. Can you tell me your name and date of birth?
Randall Creasy, June 3rd, 1985.
Can you tell me where we are today?
Manita, Virginia, in the doctor's office.
Can you tell me the year?
It is 2019.
And what are we doing today?
Head-to-toe assessment.
Okay, and are you having any pain?
No, ma'am.
Okay, good. If he was having pain, I would ask him to rate it on a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable, but he's not having any pain, so that is good. He appears well groomed. His general appearance, he's not in any kind of acute distress, and he's alert and orient ×4, so that is great. We're going to move to the head and the neck. So his head, his skin is a little bit hyperpigmented. His head and his face, his skin is hyperpigmented, possibly due to excessive sun exposure. He's got facial hair going along the jawline. I'm going to palpate his scalp. No nodules, no lesions, no tenderness, no on the scapula. His hair is evenly distributed. If you can close your eyes. So his external eyes, he's got brown, coarse eyebrows running the extent of his external eyes. He's got brown eyelashes that extend around the external eyelids. His eyelids, there's no nodules. On palpation, his eyelashes curve out. You can open his eyes. There's no redness, there's no edema around external eyes, so external eyes look intact. I'm going to look at your conjunctiva. It's pink, moist, no redness, no draining, no cobblestone appearance. Sclera is white, no jaundice, no redness. Cornea is clear with no kind of blood vessels showing or anything like that. If you can just look straight, I'm going to check your pupils. Good. So pupils are about 3 millimeters. They're round, equal, and reactive to light. His nares is about the same color of his skin. It's midline. It's symmetrical. There's no drainage, no redness, no foreign objects. He's got a few hairs in there, but no blockages, no drainage, no redness, so that looks good. His external ears, his auricle is congruent with his inner canthus of his eyes, so that is good. His ears appear to be symmetrical. There's no redness. There's no lesions or nodules or anything that looks suspicious on his external ear. I'm going to go ahead and look at his internal ear. Good. And the other side. So no drainage, no redness, no foreign objects. Tympanic membrane is pearly gray, so that looks good. His lips are pink and moist. No ulcers, no lacerations. If you can just open your mouth. Teeth are intact. No missing teeth, no dental caries. Buccal mucosa is pink and moist. Gums are pink and moist. Tongue is pink and moist. No nodules, no laceration. Hard plate is intact. No nodules, pink and moist. Soft plate is intact. No nodules, pink and moist. If I could just see your tonsils, they're intact and they're present. They're pink, they're moist, no redness, no swelling, no exudate. His uvula is midline. If you could say ah.
Ah.
So when he says ah, his uvula rises midline. Which tells me that his cranial nerve, number 9, his glossopharyngeal nerve, and his cranial nerve, number 10, his vagus nerve, is intact, so that is excellent. If you can stick your tongue out. So when he sticks his tongue out, there's no obvious deviation. That tells me that his cranial nerve, number 12, his hypoglossal nerve, is intact, so that is excellent. His neck is symmetrical. There's no pulsations, no masses, no lumps, no lesions, so that's great. His trachea is midline, so that is great. I'm going to palpate your carotid pulse. Great. Great. So carotid pulse is +2. Regular rate and rhythm, so that's excellent. I'm going to go ahead and inspect your skin. So I'm going to start with your skin turgor. That's intact. I'm going to feel the temperature of your skin. It's warm, dry. His bilateral upper extremities, his skin is intact. It's also hyperpigmented, possibly from sun exposure. His muscles are symmetrical, no signs of atrophy. His joints appear to be symmetrical. I'm going to check his radial pulses. They're +2. They're regular rate and rhythm. They're symmetrical. I'm going to check your capillary reflex. Great, that's less than 3 seconds. Chest is warm to the touch. He's got some hair, but overall his chest, the skin on his chest appears to be intact. There's no lesions or anything. He has normal rate and respirations, non-labored, easy. His chest rises and falls symmetrically, so easy, regular rate and rhythm of respiration, so that is great. I'm going to go ahead and listen to his lungs with a diaphragm and my stethoscope. I'm going to start at the apex of his lung. Deep breath. Good. Deep breath. Good. Deep breath. Breathe in and out with your mouth. turn around, I'm going to inspect your back. So back is warm to the touch. There's a few hairs throughout, but skin overall on the back looks intact. So I'm going to go ahead and listen to the posterior lungs. Deep breath. Okay, good. You can turn around. So his lung sounds were clear in all lobes. Vesicular sounds heard throughout. No adventitious breath sounds such as ronchi, crackles, or rails, or anything like that. So that looks good. We're going to go ahead and move to his apical pulse. So I'm going to feel down to the 5th intercostal midclavicular line. And his apical pulse is normal, rate, and rhythm. Now I'm going to go ahead and listen with the diaphragm of my stethoscope for the high-pitched sounds. I'm going to listen to the 2nd intercostal space, right sternal border, and that's the aortic valve. 2nd intercostal space, left sternal is the pulmonic valve. 3rd intercostal space, left sternal border is the Erb's point. 4th intercostal space, left sternal border is the tricuspid valve. And then the 5th intercostal space, midclavicular, is the mitral valve. And that is also the apical pulse. So I'm going to go ahead and auscultate the apical pulse while I'm here, which is normal, rate, and rhythm. No irregularities noted. I would also count it for 30 seconds and times by 2, and I would expect the rate to be between 60 and 100. I'm going to go ahead and use the bell of my stethoscope and listen to the valves again for any low-pitched sounds. So aortic, go back to the pulmonic, Erb's point, tricuspid, and then the mitral. Good. So when I was listening to his valves, I heard S1 and S2. I didn't hear any S3 or S4. I heard no murmurs or no splits. I heard S1 and S2 louder in the tricuspid and mitral valve, so that is good. If you can go ahead and lay down for me. So his abdomen is flat, symmetrical. The skin is intact. I don't see any kind of obvious problems with the skin. His umbilicus is midline. He's got hair distributed evenly. I don't see any bulging or protrusions. I'm going to go ahead and auscultate. I'm going to start with the diaphragm of my stethoscope in the right upper quadrant. I'm going to go to the right lower quadrant, the left upper quadrant, and the left lower quadrant. So I heard gurgles and clicks throughout, so that lets me know that his bowel sounds are present and normal active. I'm going to go ahead and palpate. Please let me know if you have any tenderness. So patient's not having any tenderness with palpitation. There's no masses. There's no masses palpated, no grimacing noted. So that is good. His abdomen looks good. So now we're going to go to his skin. So his skin is warm. He has hair evenly distributed. He has normal muscle mass throughout. I don't notice any kind of atrophy or anything like that. I'm going to go ahead and feel his posterior tibia. They are +2. They're equal bilaterally. I'm going to go ahead and feel his dorsal pedis pulses. They are also +2 and they are equal bilaterally. I'm going to go ahead and check his capillary refill. Great. It is less than 3 seconds. And I think we're good.